Malnutrition can refer to chronic nutritional deficiency or excess. Either too little or too much of nutrients. Malnutrition can also refer to specific nutrient deficiencies or toxicities. This image shows what we probably usually think of when we think of malnutrition. This is showing severe undernutrition. These children have not been getting enough of anything. This can also be what malnutrition looks like. Overnutrition is malnutrition as well. Here we're looking at obesity due to excess of the energy-carrying nutrients, but you can also get toxicity from excess of specific vitamins and minerals, like getting too much vitamin A during pregnancy causing birth defects, or too much calcium causing kidney stones. This can also be what malnutrition looks like. Here we're looking at an example of a specific nutrient deficiency. This specific example is scurvy, and it's caused by a lack of vitamin C. You see bleeding gums and tooth loss. Lack of some vitamins or minerals have specific symptoms associated with the specific functions of those nutrients, like impaired vision with lack of vitamin A, rickets with lack of vitamin D, neural tube defects if pregnant mothers don't get enough of folates. When we're talking about specific nutrient deficiencies, we can have either a primary deficiency or a secondary nutrient deficiency. A primary nutrient deficiency is where you're just not taking in enough of that nutrient. You just don't have enough calcium in your diet, or enough vitamin A, or enough vitamin C. A secondary nutrient deficiency is where you're taking plenty in, but your body can't use it for some reason. Maybe your digestive tract can't absorb that nutrient. Maybe you absorb it, but then you have something going on inside your body that keeps you from using that nutrient. Both primary and secondary deficiencies can show the same symptoms, they just have different causes. This can also be what malnutrition looks like. If you're malnourished, you may experience fatigue due to lack of energy or due to lack of iron. Lack of iron is called anemia. You may also see psychological changes, mood changes, depression, apathy. Apathy is a lack of interest in what's going on around you. I want to talk for a couple of minutes about the problems of severe undernutrition. If you have severe undernutrition, where people just aren't getting enough of anything to eat, you see symptoms that result from lack of many different nutrients, both from lack of protein specifically, from lack of calories, overall calorie intake, and lack of many specific vitamins and minerals. Wasting is a major indicator of severe undernutrition. Wasting simply indicates someone who is thinner than normal, significantly thinner than normal. And oftentimes there's a distinctive wasted appearance as well. As the muscle tissue is broken down, the arms and legs in particular become very stick-like. In children who are chronically undernourished over a long period of time, you see stunting. Stunting refers to a child being shorter than would be expected for their age and their parents' size. Stunting you only see in children because it requires a lot of nutrients and a lot of energy in order for children to grow. So if a child's not getting an adequate amount of nutrients or energy, their body just shuts down those growth pathways. They just stop growing. Oftentimes, if you see stunting, if you see a child who is chronically undernourished, they're going to be acutely undernourished as well, and you'll see both wasting and stunting. Now, malnutrition is particularly a concern if you're talking about children. Children require a vast amount of energy and nutrients for their body size. They're smaller, so they require less overall, but per pound, they require significantly more energy and nutrients than an adult to fuel that rapid growth that happens during childhood. The other reason why malnutrition is a concern in children is because their nervous system is still developing. If children are malnourished, their brain doesn't develop properly, and they may experience severe intellectual and emotional difficulties throughout the rest of their life, even if they eventually start getting an adequate amount of food. I have a couple of slides here that just illustrate the problem of childhood undernutrition around the world. This is data from the World Health Organization, cumulative since the year 2000. And here we're looking at the percent of children under the age of 5 who are underweight, so who are wasted. The highest percent is actually India at 43.5%, so nearly half of all toddlers are underweight in India. By comparison, in the US, it's only 1.3%. In the US, we tend to be more concerned about children being overweight than underweight. This map looks at the percent of children 5 years of age or less who are stunted in growth. Remember that stunting indicates long-term, chronic undernourishment. The US is at 3.9%, so a little bit higher than the underweight percentage. But the highest here is actually Afghanistan at 59.3%. So over half of the toddlers in Afghanistan, almost 60%, are experiencing chronic undernutrition. Severe undernutrition takes two forms. There's what's considered an acute form and what's considered a chronic form. Really, these two forms of severe undernutrition, there's a lot of overlap. The first form is considered a more acute form, and that's called kwashiorkor. It's referred to as a protein energy malnutrition because a lot of the symptoms of kwashiorkor come from deficiencies in protein and deficiencies in calories. Although there are many symptoms that come from deficiencies in vitamins and minerals as well. It's not just protein and calories. Kwashiorkor is the acute, so short-term, recent onset malnutrition. It's associated with infections, so the malnutrition impairs the immune system, and children with kwashiorkor develop a lot of infections. It oftentimes sets in when a child is weaned from breast milk. So breast milk is a protein-rich nutrient source, and in very poor countries, when a child is weaned, they're weaned from this protein-rich source onto carbohydrate-only foods, so rice-based foods or grain-based foods. So they may actually have an adequate calorie intake, but if all those calories are coming from carbohydrates with very little protein and very few vitamins and minerals, they're still not adequately nourished. One of the hallmarks of kwashiorkor that distinguishes it from marasmus, the other form of protein energy malnutrition, is edema. Edema simply means the accumulation of fluids. So when we get into talking about the proteins, we'll talk about how proteins are important for fluid balance in the body. And if you have a protein deficiency, then you don't have as many proteins floating around in your blood, and the fluid, the water in your blood, simply leaks out of the blood and accumulates in your tissues. And one place where you get a lot of fluid accumulating is in the abdominal cavity. So children with kwashiorkor, they'll oftentimes have these very thin, stick-thin arms and legs, wasted arms and legs, but then they'll have this big, swollen, distended belly. And a lot of that swelling comes from the accumulation of fluid in the abdominal cavity, the edema, and some of it comes from an enlargement of the liver that happens with kwashiorkor as well. This form of malnutrition is more common in very poor countries where there's famine and a limited food supply. When it does happen in the US, it's usually a sign of child abuse and or severe neglect of a child. When a child is found with kwashiorkor, you can't just start feeding them like normal right away because their body has started to shut down essential processes. Their body doesn't have the enzymes or the fluids to properly digest food anymore, and they can get very, very sick. So as part of the treatment, food must be reintroduced slowly. First carbohydrates just for the energy, and then gradually increasing amounts of protein. Marasmus is our other form of severe undernutrition. Again, it comes from lack of protein intake, lack of energy intake, or usually both. And again, the symptoms come from a lack of many essential nutrients, not just the protein deficiency. In marasmus, there's often little or no edema. You don't always see that swollen belly because the blood proteins are still preserved. Now, the reason why blood proteins are preserved is because the body breaks down muscle proteins. So you see severe wasting, severe loss of muscle mass. Marasmus is more common in children under about 5 years of age because of the increased energy needs and because children of this age have been weaned. Marasmus is what you tend to see after a more long-term undernutrition. In the US, you see marasmus in poverty-stricken populations, patients with severe chronic illnesses because your metabolic needs go up when you are severely ill, and oftentimes your food intake goes down. You also see it in the elderly that have poor nutrient intake, and this is the type of malnutrition that you see in patients with anorexia. Sometimes you also see small children with marasmus if they're given non-milk beverages with inadequate protein. One of the reasons why dairy is important to give children is because of the protein content. And if children are not getting their dairy and are not getting protein from other sources, they can develop wasting. Here are a few questions you should be able to answer after studying this video. First, explain the different types of malnutrition. Second, explain how severe malnutrition impacts the body. Third, distinguish between kwashiorkor and marasmus. And last, but certainly not least, explain why malnutrition in children is particularly devastating.